Currently, I'm receiving a lot of calls from my friends, family members, and patients regarding COVID-19 and some clinical illnesses which they are experiencing right now. I'm going to explain the steps to prevent COVID-19 spread if you are sick. And these are the steps and guidelines from American College of Physicians. So first thing, you need to keep in mind that this disease is real. There is no hoax, and don't believe in any kind of conspiracy theory. This is a real virus. People are recovering nicely, and a lot of patients, they are asymptomatic. And there are some patients who are getting more sick because they have some underlying immunocompromised states, or they have comorbidities like diabetes, heart disease, and they are of high risk of having complications from this virus. The most important thing is, if you are sick and you're not sure whether you have COVID-19 or not, then the first thing you should do is stay home. Because COVID-19 have mild illness, and in most of the cases, it is recovering on its own and does not require any medication. Only leave home to seek medical advice. Go to your doctors, but don't move around if you're sick. Take care of yourself. Eat healthy, get some rest, hydrate yourself properly, eat good amount of food, sleep well, and not to worry if you are not having any serious or warning signs. Stay in touch with your doctor and let him know whatever symptoms you have, because I'm not sure if you have facility to get your COVID test done. So call your doctor and discuss your case with him. Avoid public transportation like taxis, Uber, or ride sharing, because there is a high chance that you can give this infection to other people. Another important step, separate yourself from other people. If you're at home and you have other people surrounding you, avoid it. And if you have to be around them, then cover your face with a cloth. And if possible, use a separate bathroom and separate bedroom. Watch for your symptoms. People with COVID-19 have a wide range of symptoms, ranging from mild symptoms to severe illness, and it may appear 2 to 14 days after the exposure. People with these symptoms may have COVID-19, fever, sore throat, congestion in your throat, cough, difficulty breathing, body aches and pains, headache, diarrhea, new change in your taste or smell, fatigue, and also follow the guidelines from your local health department and from your doctor as well. When to seek medical attention. So if you have emergency warning signs like difficulty breathing, or you have oxygen saturation monitor at home and the saturation is dropping below 90, or you experience chest pain or chest discomfort, or change in mental status, bluish discoloration of lips and face. So if you experience these warning symptoms, then call your doctor immediately. If your doctor is not available and you are very sick, call 911 or emergency service to go to ER immediately. If you do have appointments for some other medical problems and somehow you get sick with a new illness and your suspicion is high for COVID-19, then you need to call your doctor office and let them know. So when you're going to visit them, then they can have better preparation so that they can save themselves as well as the patient who are visiting their office. And it is better that if you are fine and you don't have any acute issues, you can postpone your visit to doctor's office and you can discuss your issue on telemedicine. If you are sick, wear a cloth covering over your nose and mouth. If you're alone at home, then you shouldn't wear that, and you don't need to use specialized masks which are meant to be used by healthcare providers or first responders, because there is a shortage, and I would recommend using cloth masks. You can make it with any cloth or bandana to cover your face. If you are coughing and sneezing, it's a simple rule. Cover your face while you're coughing and throw away that tissue in a lined trash can, and immediately wash your hands with soap and water for 20 seconds. If you do not have soap and water available, then you can use hand sanitizer, which should have 60% alcohol in it. Clean your hands often and avoid touching your nose, mouth, and face with unwashed hands. Avoid sharing personal household items like plates, drinking glasses, utensils, spoons, fork. Wash these items thoroughly after use with soap and water, or put it in the dishwasher. Clean all high-touch surfaces every day. And those high-touch surfaces are like telephone, keyboards, doorknobs, counters, tabletops, faucets in the bathroom, toilets, And I would encourage the sick person to clean their own areas. And if it is not possible, then it can be cleaned with proper measures like using gloves and proper mask. And don't clean it very frequently. You can just clean as needed. So when it is safe to meet other people, you can be with other people after 3 days with no fever and no respiratory symptoms, or 10 days since symptoms first appeared. If you continue to have no symptoms, you can be with others after 10 days have passed since test. Depending on your healthcare provider's advice and availability of testing, you might get tested to see if you still have COVID-19. You can be around others after you receive 2 negative test results in a row, at least 24 hours apart. For anyone who is around a person who is COVID-19, he or she should stay home for at least 14 days. Currently, there are no antiviral medications recommended for COVID-19, and there are certain medications like hydroxychloroquine or chloroquine used alone or in combination with azithromycin is not recommended for prophylaxis use of COVID-19 infection because it can do more harm than benefit and only can be used in hospitalized settings after getting consent from family members on a trial basis. But at this point, the data is not very much clear. Finally, you need to understand that if you have a clinical suspicion of having COVID-19 and you are sick and the symptoms which I mentioned to you, then stay at home and don't take too much stress because in majority of the cases, COVID-19 patients have milder symptoms and they recover on their own. There are very few patients who are at high risk and who are having underlying comorbidities. They are getting worse. And these are the patients who need to go to hospital. The rest of you need to stay at home, eat well, sleep well, and don't take too much stress because you need to build up your immunity, and under stress your immunity goes down. Stay safe and stay healthy. It's a difficult time for every one of us because we are all learning every single day about this disease. Thank you very much.